Hello everyone. Myself, lecturer Miss Aditi Anil Kushare, Master of Pharmacy in Quality Assurance Techniques from KK Wag Institute of Pharmacy, Chandori, Nasik. Today we are going to discuss about the topic ointment, that is selection of dermatological vehicle from pharmaceutics too. So the topics to be covered from this session are as follows: introduction to ointment as a semi-solid dosage form and selection of dermatological vehicle. Then let's see about the definition of ointments. Ointments are the homogeneous, translucent, viscous, semi-solid preparations, most commonly a greasy, thick oil, that is oil of about 80% and water up to 20%, intended for external application to the skin or mucous membrane. Drug ingredients can be dissolved, emulsified or suspended in the ointment base. Selection of dermatological vehicle. Following are the factors which govern the selection of an ideal basis for ointments. In that, dermatological factors and pharmaceutical factors. So let's see first about dermatological factors. In that, there are 7 points: absorption and penetration, effect on skin function, miscibility with skin secretions and serum, compatibility with skin secretions, freedom from irritant effect, and emollient properties and ease of application and removal. So let's see. In the diagram there is structure of skin. In that, we all know the upper layer of skin is epidermis, second one beneath to epidermis, that is dermis, and beneath to dermis there is a hypodermis. Then blood vessels are also located in that. Then hair follicles are there, sweat gland is there, fats and connective tissues are also present in the skin. Then let's see the first factor, that is absorption and penetration. Absorption means the actual entry into the blood stream, and penetration means passes through the skin. The skin has the 3 main layers: epidermis, dermis and hypodermis. Scientifically, that proved that the animal fats like wool, fat and fixed oils penetrate more readily through the skin in comparison to mineral oils, that is paraffin. The substances which are soluble in both oil and water are most readily absorbed. The O/W, oil in water emulsion bases, release the medicaments more readily than oleaginous bases, means water in oil emulsion bases, that is WIO emulsion bases. Then second, effect on skin function. Greasy bases may interfere with the skin function like heat radiation and sweat excretion, and also they irritant to the skin. The oil in water bases, means water soluble bases, gives cooling effect with healing effect, and also they readily mix with skin secretions, miscibility with the skin secretions and serum. In that, emulsion bases are more readily miscible with the skin secretion compared to greasy material. For that reason, the small amount of drug is needed when the emulsion bases are used. Oil in water type of emulsion bases are readily miscible with the serum and are very useful for the ointment base for weeping eczema. Then fourth one, compatibility with the skin secretions. The neutral pH ointments are compatible with the majority of the medicaments, and also they do not cause discomfort in use. The ointment bases should have a pH around 5.5, which is the average pH of the skin secretions. The freedom from irritant effect, that is ointment bases should be non-irritant. Greasy bases causes the irritation and may cause oedema. The ointment used for eye ointments should be non-irritant and free from foreign particles. Also, the all ointment bases should be high standards of purity. Then emollient properties. The ointment bases should be emollient properties, that it should be able to keep the skin moist. The humectants like glycerin and propylene glycol keep the skin surface moist and soft, and wool fat, paraffin used for the skin soft and preventing the loss of moisture from the skin. Then ease of application and removal. The ointment bases, it should be removed easily from the skin. So the stiff and sticky ointment bases are not suitable. Also ointment bases should be easily applicable and it should be sprayed on the skin surface. Then next one, that is the pharmaceutical factors. There are total 4, that is stability, solvent properties, emulsifying properties and consistency. In that first, stability, the fats and oil obtained from animal and vegetable source have to undergo oxidation, so antioxidants are used. Oil in water type of emulsion ointment bases are liable to microbial growth, so need to preservatives. Emulsified bases are liable to face separation due to improper formulation or under influence of temperature, so it required to store in a suitable temperature. Then solvent properties, most of the medicaments incorporated with the ointment bases are insoluble with it, so necessary to mix finely powdered drug in ointment bases. If phenol used in solid form with the ointment bases, it causes the blisters, so choose the suitable ointment base which should keep phenol in solution form. Mixture of hard and soft paraffin, beeswax, ointment bases are used for phenol. Similarly, in the preparation of compound mercury, ointment olive oil is used to keep the camphor in a solution form. Then emulsifying properties, hydrocarbon bases absorbs the less amount of water compared with the animal fats which can absorb a large quantity of water. For an example, wool fat can absorb the 50% of water, but when it mixed with other fats and can take up several times of water or hydroalcoholic liquids, so wool fat is included as a base in the eye ointment preparation. Then consistency, fourth one, that is the consistency of ointment should neither be too hard nor too soft. The consistency of an ointment can be adjusted in such a way that in soft ointments included have the melting point substance like hard paraffin, beeswax. So the soft ointments must be stable in a summer season. In hard ointments it included the lower melting point substance like liquid paraffin. So hard ointments must be stable in a winter season. What we learnt from this ointment, that is selection of dermatological vehicle, the learning outcomes are: what is ointment as a semi-solid dosage form, then selection of dermatological vehicle. Thank you.